volunteer. I'm on the board of directors for NAMI Staten Island. I've been since about 2009 involved with NAMI.
Wow, that's great. And so tell me about this ribbon campaign. I know you guys have probably been working hard doing this.
Yeah. So this campaign is a statewide ribbon campaign to bring awareness, as everyone has said, about mental health, brain disorder. So we start a dialogue and to decrease the stigma of someone who has a mental health issue. This is a visual start of a dialogue. So May being Mental Health Awareness Month, it is very focused on that. But I also want people to be aware it just does not stop in May. This should be a day-to-day dialogue in education. If people don't know and they think that something is wrong, they can go to the website NAMI.org and look and learn. We have been out throughout the community, throughout Staten Island, so that we are very cultural sensitive to how people perceive and understand mental health. And that in itself is a stigma. So the more we speak of it, I think the less fear and negative attitude people will have. That's a hope. That's a hope. But this will be a start. We, as Linda had said before, we have free support groups for those that are suffering with mental health and for families. It's not only the individual, it is also families. So, and what I find very important too is, as Pete had brought out, is that addiction being such an epidemic, that people have to understand that mental health co-occurs with that. Patrick Kennedy has also espoused this throughout. And so people need to treat people with dignity and compassion. A favorite quote that I try to live by is, "It's great to be great, but it's greater to be human." And that was by Will Rogers. And I think that if people think of that, and if they themselves think about just being human and understanding that if you don't know what to do, you can call NAMI. We have pamphlets, we're on a website, and I think that's very important. And I appreciate people taking the time because mental health is something that people don't want to talk about and are fearful of. And I would hope that you would come back and talk to us and interview our behavioral health nurses and people that are involved, because the more people hear and see, the less fear and negative attitudes people will have. And my concern is for children. You know, if we get to treat earlier, the chance for recovery is better. That's why we say find help, find hope.
Okay.
Thank you.